Hi everybody. I'm Dr. Heuser, and this is the Heuser Clinic podcast for this week. I want to talk about cholesterol and what the numbers mean, how to interpret your cholesterol results, what it means, and we'll talk today about how to get your bad cholesterol down and your good cholesterol up, and how you can do that using exercise and nutrition. And then if that doesn't work, then we have to use some medications to correct that as well. But we learned back in the 1960s that people that have high cholesterol have higher rates of heart attacks. And once we found that we could lower cholesterol, we could actually prevent heart attacks and prevent the blockage of the coronary arteries that leads to a heart attack. So you've gone to the doctor, they've drawn your blood, and the results come back, and it can be kind of confusing. So let's go over the numbers that come back from your report. They're going to give you the total cholesterol, and that's going to be a number somewhere between 100 to some of you even up into 300s. And we like to see the total cholesterol under 200. That's our goal. The bad cholesterol is the low density lipoprotein, or the LDL. We like to have the bad cholesterol under 100. HDL, the high density lipoprotein, is the good cholesterol. We want to have that greater than 50 if we can. And your triglycerides, the other fat particles floating around your blood, we want to have that under 150. Well, what does all this mean? Cholesterol is a fat molecule, and it's found in all our cell membranes, and it's found in all the food that we eat. But we want to stay away from foods that are high in cholesterol and high in fat, and I'll tell you why that is. But cholesterol that we eat comes through food from our digestive tract, and our liver also makes cholesterol. We make it naturally because it's such an important molecule. So cholesterol in our blood, the cholesterol molecule is a fat molecule, so it's not dissolved in the blood. So to transport it in the blood, our bodies wrap it. So you take individual little cholesterol molecules and we wrap it with another molecule that's a polar molecule that is soluble in water or in our blood. So this is the particle, the LDL or the HDL. These are actually particles that are floating in our bloodstream. And they have different sizes and they have different densities. So it's the size and the density of the particle that makes a huge difference, and makes a difference between good cholesterol and bad cholesterol. So the LDL is a low density, it's a fluffy, big particle stuffed with triglycerides and fat molecules floating in our blood. The cholesterol molecules in this particle will be deposited underneath the lining of our blood vessels and starting to form a plaque in the lining of a blood vessel. And eventually the plaque will get so big that it will occlude the whole lumen of the blood vessel, or the plaque can rupture and block the coronary artery. So the LDL delivers the cholesterol to the blood vessel. The HDL particle, the high density, smaller particle, actually collects the cholesterol that's deposited within the blood vessel and takes it back to the liver. So this is the good cholesterol, the HDL, and that's the number that we want above 50. The other number that's going to come with your report is the triglycerides, and that's another fat molecule floating around in our blood. That's packed in this particle along with the cholesterol, and we want that number to be low. This plaque has triglycerides and cholesterol in it as well that's developing inside our blood vessels. So the first thing we want to do is avoid eating foods that are high in cholesterol. Things like the egg yolks. The yolk of an egg has a lot of cholesterol in it. Cheese and fatty red meats have a lot of cholesterol. So does bacon and sausage and fatty pork products. Cholesterol occurs in much of the animal foods that we eat. So I really want to cut down on the real cheeses, go to fat-free dairy, go to egg whites, not whole eggs. We got to cut down on the fatty red meats that we're eating and the fatty pork products that we're eating. We're going to take those out. If I have real cheese as an hors d'oeuvre with dinner, the next morning my cholesterol will go up 50 or 60 points just from eating that cheese the night before. So we have to avoid eating foods that have cholesterol in it, and we have to avoid foods that stimulate the liver to make more cholesterol. And what we found is it's the saturated fat, saturated animal fat, that causes our liver to make cholesterol. So it's all the fatty foods that we need to remove from our diet to lower the cholesterol. In addition to the fatty foods, the highly sugary foods can add to it. It's a very complicated metabolism. So it's fat and sugar that we need to remove from the diet. So the foods we eat are really important. Now, the other thing we can do to lower our total cholesterol is to have an exercise program in addition to the right nutrition program. So the best results I've had with exercise and lowering cholesterol, we have to accomplish several things. We have to have a good cardiovascular endurance program and a muscle building program as well. So we have to build muscle, but we also have to have a strong heart and lungs and strong cardiovascular workout. So we got to do a cardiovascular workout on the treadmill, and we also have to lift weights. And the third thing we have to do is get our waistlines down. So if we can lose that abdominal fat, your blood levels of cholesterol will come down as well. So we have to eat the right foods. We have to do the right amount of exercise, and we have to do effective exercise that will keep our waistlines small. So guys, we got to get our waistlines down under 40 inches. Girls, our waistlines have to be under 35 inches. But I found if we can do that, if you'll exercise, both cardio and weights, if you'll eat the right foods, then that's the most that you can possibly do yourself for lowering your cholesterol. If you eat right and you exercise and your cholesterol still is high, then absolutely we need to go on the medications, the statin medications like Lipitor, to get the cholesterol down. They're effective, and Lipitor's been proven to prevent heart attacks. Well, I know this is complicated, and it's hard to understand. It's a lot of physiology at one time. So if you have questions that you'd like me to answer, please email me at info@heuserclinic.com with those questions, and go to the website heuserclinic.com for other information on health-related topics, and let me know what topics you'd like to discuss on the podcast here. As you know, this is a Heuser Clinic, and we're the science of fitness.